Assalamu alaikum viewers. Please subscribe the channel, like the video and share. Placenta is a structure that provides the blood supply from the mother to the fetal tissue. See the placenta previa, that is the placenta that is close to the internal os of the uterus. There are different types of placenta previa. It could be low lying, that is somehow it is away from the internal os. Marginal placenta, that is near the margin of the internal os. Then it could be the partial placenta previa, that is covering the internal os. Then there could be complete placenta previa, that is covering whole of the internal os going toward the. This is the pelvic scan of a 28-year-old female. This is her second baby. She has first baby 8 year back. You can see the pelvic scan and the lower lobe of the placenta. That is very clear. It appears to be type 1 placenta because it is within 2 centimeter away from the internal os. Placental localization is very important part of the OBS ultrasound. The BPD, HC and the FL correspond to 37 weeks approximately. This is the placenta, that is fundo-interior, and it is of grade 3 maturity because you can see the sinuses as well as calcification within the placenta. So placenta previa is the placenta that is having its lower edge near the internal os. It could be type 1, type 2, type 3 or type 4. As described before or in the previous part of this scan, it is away from the internal os, and on power Doppler you can see the blood vessels within the lower lobe of the placenta. Placenta previa may be having the elements of placenta accreta. That could be more even dangerous situation during the surgery. Placental localization is very important because it tells about the severity of the C-section or the normal delivery, or doctor is prepared for a complicated outcome. So placental localization is very important part of OBS ultrasound. You can see the fetal cardiac activity that appears to be normal. Liquor in this case is scanty, and the female is having lower abdominal pain and sense of heaviness. She has one episode of bleeding in early pregnancy, that is first trimester. In first trimester there are more chances of bleeding in the lower placenta or placenta that has its lobe in the lower uterine segment. But as the pregnancy advances, there are chances of the placenta moving up. So the parameter correspond to 37 weeks approximately. Baby size is of appropriate, weight is good enough, and gender appears to be male. This is the abdominal circumference. You can see the abdominal circumference. Sometimes radiologists divide the placenta previa in partial complete or marginal types. The partial is away from the internal os. The marginal is present near the internal os, and complete placenta previa is that one that is covering the whole of the internal os. That is the most dangerous type of the placenta. So, localization of placenta, its maturity, and to determine the placenta previa is very important part of the OBS ultrasound. These are the fetal parameters. You can see clearly from the table.